So we're good?
Yep.
So it was right side? Yeah, okay. How did I know it was right side? Because when I go like this, his ankle clicks. Yeah? Okay. So just, anybody want to feel that? Like literally just rock the ankle? Yeah, rock the ankle and feel it click. Sorry, we're using it as a guinea pig. Yeah, go for it. Go, go, go.
Yeah, take turns.
Yeah, so rock it back and forth, and you'll feel how easy it is to click the ankle.
Do like a jostle.
Yeah, like a jostle.
Oh, there you go.
So you would say that would be affecting the hips as well, because
Right,
of the knee.
because of the jostle. You feel it? Yeah. So when somebody has everything that I do, everything that I teach you is part of an assessment. This is not just regular reflexology, this is palpatory reflexology. So even when we're doing a relaxation technique, even when we're doing a walking technique, we're assessing for the deeper issues here. So that first technique, that first just let me grab the heels and see what's going on. Just, hi, how are you, how you doing? Revealed so much information. Because that right ankle started clicking, which means when we look at the structural alignment of the ankle, representing that hip space on that side, a misalignment there means a misalignment there. So what's in between the ankle and the hip? The knee. Yeah? It's fascinating. And if we also want to look at his feet, clients always, they will try to erase the evidence. They will never erase all of the evidence. And so when we look at the bottom of his feet, I'll point out one more marker real quick. Yeah. So we can see on this side he has a callus.
Right.
On this side he does not.
Overcompensation.
Overcompensation.
Spreading
Yep.
that way. That's
Exactly.
Trying
So-
to balance.
But then also the idea of right side shoulder impingement.
Yeah. Am I seeing flaking from there or no?
Yeah, there's other stuff. Anyway, so and this is even before we do the technique. And part of the foot reading aspect of this course that I teach is the idea that you don't even need to do the manual work in order to give a successful session. We could have a conversation just about this. Yeah. Anyway. Okay. Before we get too distracted. Okay, so right now, the first 2 points that we press are the solar plexus and the adrenal. And then for those of you that are sticking around, we're also doing pulse assessment on the dorsal aspect of the pedal artery. So his pulse is very watery, very deep. Yeah, deficient, which we can see via the dryness as well. The body does not have the energy in order to produce a strong pulse. So that confirms just some of the basic things. And when we think of strength, strength is the exact same thing that we would need in the pulse to produce a strong pulse as we would need in the ligaments to produce a strong joint. Yeah. So then we move into the adrenal reflex. Fabulous. And already his right leg is starting to twitch and move. So the nerves are starting to open. Yeah.
You're pressing the on button.
Yeah, the on buttons. Right. Okay. Grab me one of those dry towels, and if somebody could grab me 2 hot towels from the cabbie. Thank you.
There you are.
Fabulous. Hot towel wrapping is an essential skill, especially for those of you dropping in. If you don't do it, I highly encourage you learn how. Not only does it feel nice, but as an assessment tool, where the body chooses to absorb the heat is very telling. It's kind of like one of those art pieces where they do really bright, vibrant colors, and then they'll do like a top coat of black, and then they'll etch away the black to reveal the color underneath. That's exactly what we're doing with the temperature of the hot towels. We're moistening and warming, but where the tissues don't respond to the moist and warmness, give us deeper assessment skills. Who said what?
Sally Kay says she loves you and that your hot towels are the best.
Oh, Sally.
Hi,
Love
Sally.
you. All of your students from your amazing class are here, and they love you so much.
I was going to say we've got AJ, George, Sandy, me, and Sam all here from your class. So we've got a sixth of your class.
That was amazing. Yeah? It was amazing. Wow.
You can also compare it to like when you go to the
Sally will
dentist as a
be back
kid.
again one day.
And
That's right.
got
She
stuff
sends you
on
all
your teeth
kisses.
and it shows
Yeah.
that,
Yeah, any form of contrast. It's the exact same thing.
Jersey, Connecticut.
Yeah, that's a great analogy.
I don't know what she did.
So as we get more specific, I am
Oh yeah.
drying his feet because that's what happens after you place wet towels. But as I'm drying, I'm feeling for what direction his ankle moves and what it doesn't move. Like what direction triggers the pop. Yeah? And based on the rotation, I can tell about what reflexes are going to need the most work, but also what muscles aren't working appropriately and things like that. And same thing. I'm pressing the heat in again, but I'm also doing more of those jostling movements. I'm also trying to see exactly what and where the compensating ankle is doing.
Hello from Buffalo, hello from London.
Hey, Buffalo in London. Okay, so now we're going to start on the right foot, which means the left foot has to take a break. It gets wrapped in the dry towel and just gets a nice snooze. Okay, so now we move into the right side. We start with just some basic relaxation techniques. Notice, as I'm doing the relaxation technique, I don't feel the pop because I'm manipulating the distal aspect of the foot and not the proximal aspect. Same thing, when I manipulate the talus, I'm not feeling the pop. So it was only when we touch the true calcaneus, which means that it's literally just the leg, yeah, which is both good and bad. It means that the knee is the issue, but it also means that the knee is still an issue. So we do a nice calf massage. Nothing fancy, but just palpating the tissues to see kind of where somebody's at structurally. And it feels good.
Yes, it does.
Yes, it does. The relaxation techniques are nice, but they are not the focus of your session. Get in, get out, move on. Do you feel something with that one?
I was just actually what was going through my head was just how great of a reminder it is how just like the little jostle on the calcaneus you're doing, even feeling all the way up to the top of my head, everything kind of shifting, and just kind of reaffirming how everything is connected, and also just enjoying getting a little work because us basically healers need to make sure ourselves are taken care of.
Totally. Did you hear that, Karen and Dan? Healing the healer. We just talked about that last night. Okay, so now we're walking the spinal reflexes. So just doing a little bit of thumb walking, which is where the thumb appears to be walking or inching along the spine. Then we move on to the toes. While we do the toes, anybody else want to talk about stuff? It can get really boring really quick, so you're going to have to keep me entertained.
Sinuses.
Sinuses, yes. So toes and sinuses, everything comes down to hot, cold, wet, dry.
Mm-hmm.
So when we look at the toes as not just the neck but the head, yeah, the pads of the toes representing the head space, we're palpating for whether the sinuses are cracked and dry, whether they're moist, overly so, like puffy, yeah, whether they're hot and inflamed, whether they're stuck, rigid, calloused.
While we were in Maryland last weekend, one thing that I noticed was a lot of people, the second day that I was doing treatments on people, had issues in the sinus area because the temperature dropped like 20 degrees overnight, and they were walking in and out of like air conditioning and heat, and the temperature changed and the moisture changed. It was just wreaking havoc on everybody, and every single one of them were like, yeah, I'm screwed right now. And I was like, yep, that's about right.
Yeah, so go ahead,
I have a
AJ.
question. What about the effects of like migraines? Since you're working on the head space, the toes and all,
Yeah.
how do migraines like present themselves? I mean, somebody can say I have migraines, but we know it has something to do with the head space. But looking for causation outside of stress, could there be?
Very interesting, and another great example of why symptom labels are ineffective in our industry. Part of our scope is not to diagnose, prescribe, or treat. Yeah, we are assessing, coaching, and educating. We are not going to DPT. We are going to ACE, assess, coach, educate. And so when we look at somebody coming in with the label of a migraine, yeah, the migraine may be happening in the head, but just like diabetes, what we talked about before, the causation is elsewhere.
Wow.
People who have migraines normally fall, like 90% of my migraine cases have a trifecta. It's going to be women under the age of 45 who are on birth control, have severe anxiety and digestive issues. Yeah. Those three things tend to trigger the massive amount of depletion and stress, which triggers a migraine.
Side note: when you were doing the light pressure
Yes.
on the like anterior portion,
Mm-hmm.
Just had a twitch response in the lower back.
Yeah, twitch response in the lower back. Love it. So there are four things that we look for in regards to somebody receiving the work with reflexology. The first would be muscle twitches. Yeah. The second would be facial itches, breathing changes, and then stomach gurgles. Yeah.
Had a few stomach gurgles so far.
Yeah. So those are all triggers for the parasympathetic nervous system, the rest and digest system of the body. So as we're asking the nerves to wake up, as we're asking the body to come back to life, kind of, come back to balance.
Feeling a little like sting on the posterior, like in the on the back side of the knee area.
So his knee is starting to activate now. Good stuff. For those of you who are watching, he also has a knee replacement. So we're really looking, since this is the skeletal system weekend, we're looking to work on somebody who has skeletal issues to show kind of how reflexology triggers that healing process.
That
and-
was like a lighting up feeling going on down my calf.
Yeah.
On the backside.
So love it when clients are vocal. They don't necessarily need to give us the play-by-play, although it's helpful for teaching purposes, kind of for somebody to be vocal. But I encourage you to relax and enjoy
absolutely.
at the same time. The thing with injuries, especially injuries that are very painful or traumatic, is that sometimes they bring painful or traumatic feelings to the surface. So when somebody experiences a sting or a spasm or a deep ache on the table, it's not a bad thing. You didn't hurt them, especially since we're not digging into the tissues. We're compassionately kind of lighting things up and feeling for where things are at. We're going to do a couple extra passes here.
Now it feels like my left side is lighting up.
Yeah, so compensation patterns starting to light up. And that's how reflexology moves through the body.
Right.
It starts to go to one area, and then it'll move to a next, and then it'll move to a next. But if it finds a blockage somewhere, it'll really start to chew on that space. So when a client comes in and their stomach just won't stop gurgling the entire time, it doesn't mean that they're hungry. It means that the body is actually taking the session into that space. Mm-hmm. Same thing with repeated muscle twitches, facial itches, breathing changes.
Hi from Barrie, Canada. Hi from the UK.
Now his body is starting to undergo a cold sweat response, which is good. You know all about the cold sweat response, which is not just a sign of physical release, but also slight emotional release as well. So the body is really starting to dig. Cold is the tissue state of bringing things in deeply. So whenever the body goes cold during a session, it really means that we're kind of dredging stuff up, which is good. Sally talked a lot about the body going cold with lymphatic movement as well in her class. So all good things. Oh, and we found a point. So points, when we look at reflexology, the routine itself is just meant to get you from point A to point B. Yeah? The only job that the routine does is to keep you moving through the reflexes long enough to find the points that the body asks you to press. How do you know that you're on a point, would be the next question. Would be, you feel it, which is why you kind of need to turn your feelers on a little bit. You'll feel it because the tissue will be different. You'll feel it because when you press that spot, there's a visceral urge inside of your body to stay there. Yeah. Their body will communicate to your body, ooh, what is that? It's almost like your mother instinct kicks in and you're like, oh, baby, come here. And you do. You stay and you wait until the body tells you to move on. Which is lovely. So now we're just holding on to that callus on the zone 2, zone 5.
More left side tingling, like right in the knee joint.
Okay, so knee joint on the opposite side. Always freaks a client out. Always, 100%. When they're on the table and they come in for a right or left-sided issue and the body decides to work on the other side, they're like, is the body stupid? Like, why did it take it to the other side? The issue is on the other side. And then it becomes a beautiful educational moment for us to say, no, you don't understand. This didn't just happen to the one side. Yeah?
The initial injury that spurred the knee replacement happened about 15 years ago from an ACL tear.
On the left?
On the right side.
On the left. Okay.
Or
Right.
toward the right side ACL.
Gotcha.
Then got reconstructive surgery 2 years later, but lots of buckling and grinding and unbending in between that 2-year time span, which kind of sort of deteriorated it enough to sort of put it down the process of deterioration, of course, of the following 12, 13 years. And by the time knee replacement came along, there was like bone growths and spurs, all the spurs. The actual alignment of the knee was kind of tilted to the right about 2 to 4 degrees, or tilted laterally 2 to 4 degrees. And so the moment the doctor saw it, he just immediately was like, that's gotta go.
Yeah.
Well, and anytime you have those intrinsic ligamentous injuries, it immediately sabotages the other side, because it's like kicking the strut out from one side of something and letting the other side try to balance on one end. It's crazy how much damage it does, almost immediately.
Yeah. For just some elemental background, again, for some of my students, we can see the earthy aspects of his feet. Yeah. The calluses, the strong bony placements, the width. Yeah. Those earthy placements give his constitution a propensity for joint issues, just naturally. But because we see the opposite element in his tissues, all of this dryness, all of this hypermobility, all of what he's saying about ligaments not behaving properly and needing to buckle down through things like spurs and fibrous growths, yeah, that's literally an infection of earth or an infection of air in an earth constitution, is how we would talk about that. His body has become so depleted that it started to mistreat the skeletal system in such a way that, made it weak, which he then probably, exacerbated that through certain movement styles and habits. But the body itself being depleted by nature, but not necessarily having a constitutional imbalance, just his lifestyle was depleting, probably on a vegan diet, or not eating as much calorie-wise. And so the body, being naturally sturdy, didn't have the resources that it needed to rebuild, which then, was a hotbed for the ligaments to snap.
The backside of my thigh back here is almost tit for tat there for us, just kind of like sort of lighting up.
Cool.
Feels really cool.
Yeah. Always super cool.
Also, hello from Scotland, Ireland, and Texas.
Yay, Scotland, Ireland, Texas.
This may be thinking too deep. Anything for me. If someone say, so he's an earth
Right.
constitution, can a person have such a level of infection of, say, air that it starts to resemble an air constitution? So when reading the feet, can that make it a little wonky?
So his foot shape will never
Never.
change in that way.
Okay.
He has too much earth in his system
Mass.
to really be, yeah, exactly. That's a great word to say it. Like
Is it
mass, he has
Mass.
too much.
It's the bulk of it. It's just,
Okay.
Yeah,
it's all, it's
There's too much of him to be a dainty princess. Let's
Right.
just put it that way.
So you can see the thickness, the thickness of the bone.
Right, exactly. That will never deteriorate to the point of being unrecognizable as an earth constitution.
Okay.
Yeah, and that's like when Scott teaches his Ayurvedic class and he talks about prakriti and vikriti. You know, somebody's natural inborn state. Like his natural inborn state is very earthy, very ligamentous, very locked down, very stagnant. But he's fought that his entire life, and he's tried to break free of that restriction, and he's done it effectively to detriment. Yeah. So much so that he literally had to put metal in his body to ground him. Ooh. Interesting. It is metal, correct?
Polycarbonate.
Polycarbonate.
But, yeah.
Something denser than...
Something dense.
Yeah.
titanium.
And hello from Tennessee.
Yay, Tennessee. Okay. So after we walk the ball of the foot, the upper and lower digestive reflexes, we do the toes one more time.
It's funny you're mentioning that. Just my digestive system
Oh, yeah.
is responding as soon as you're like, oh yeah, we were right here. So,
Yeah. Always freaks a client out when you hit that one digestive reflex and the stomach just goes...
It's bad.
Yeah. Fun Jeopardy fact. Anybody know the name for that noise?
Gurgling?
Gurgling. Not very scientific, but correct. Borborygmi. Borborygmi is the name for stomach gurgling. The peristaltic gurgles.
Peristaltic.
Don't go Googling
Peristaltic.
while you're getting into it.
I'm putting it in my notes. I got my notes page open.
Yeah.
In case
That's
anything.
awesome.
Anatomy nerds need to know.
Yeah.
It's a thing.
That's going to be a new blog. Anatomy nerds.
No.
Is it too long
Yeah, because I need something else to do.
to do? Yes. On your list.
Because we are working on it, and this was a question that came up in Maryland as well. There was a question about if somebody has so much callousing and so much rigidity on the body, wouldn't we want to press through that in order to get them to feel it? And the answer is no. One of the reasons for that is because we can then ask the question, what is that callousness protecting? Yeah. If the body feels the need to get defensive in a tissue state, then there's probably some hypersensitivity underneath that we need to be aware of. So not going in guns a-blazing is even more important when the body is in a very calloused state.
I would almost think you need to press it less. It's like imagine
Yeah.
pressing. It's like almost having like a ball on top of whatever. Like imagine pressing like it's said so much on top of like my body, but if there's say like a ball or a block, it's like you're still. It's almost as if a pre-installed tool to get to it.
Mm-hmm.
Yeah. Yeah. Okay, so now we're into the heart of the lower body reflexes, into the medial and lateral surfaces of the calcaneus, and can I just say that this boy's glutes are so tight. Probably some of the tightest that I've felt in a really long time. So we're going to hold all of these things, and we're just going to unwind very gently. So the lateral surface of the calcaneus is all of that glute tissue. Yeah. The medial surface would be more skeletal, would be more sacrococcyx lumbar.
Mild pain response happening on the anterior side of my ankle, like right above where you were at immediately. Very mild though.
It's so crazy. The fascial density is just ridiculous. It never ceases to amaze me how powerful the body is. And when I feel tensile strength like this, it's just blows my mind.
And again, I'm going back to probably one of your videos where you were saying if there's an overgrowth somewhere, there is an undergrowth somewhere else.
Yes.
Mm-hmm.
Yes,
So
exactly.
if you had all those bone spurs and calcifications around the knee, where is it lacking at?
See, that's the thing, is the body overgrew because of the weakness to protect it. Yeah. It's the same thing why the glutes are on edge, because they're defending the castle.
Mm-hmm.
Now, how long would it take to replenish, and this is just hypothetically,
Yeah.
say that it was taking some of the bone out of the hips.
Mm-hmm.
How long after now they've removed that overgrowth would the hips take to respond?
It depends on lifestyle. You know, it depends on if the surgery was due to remove density, but the body put that density there for a reason.
Mm-hmm.
The body was literally trying to get him to stop moving.
Okay.
Yeah. Then we kind of overrode the body's protective process. So in some ways it may not fix the issue. Yeah. Because the body wanted things to stop, not to find a loophole and move around.
Right.
So now we're into the hip, so we're really getting into the joint space. But the issue with depletion is that it has to come from dietary aspects. We need to feed the body properly, but then also using more calories than we consume becomes part of the issue.
Mm-hmm.
If, he's a strapping young dude and he's pushing and pulling and grinding and doing things that he's not digestively compensating for, then the body won't have the fuel in order to rebuild.
Mm-hmm.
So we want to just be aware of not just the surgery itself, the conditions surrounding the surgery, elementally, not just what shows up on the x-ray, but what's showing up in the tissues. Oh, you're lucky Lena's putting her hands on you.
I did. I felt drawn.
I
to
felt
you. I've
drawn
been having
to
to fight it this whole time.
And the lucky Lena winner is.
Lucky Lena winner. Oh, I love it so much. Okay. So now we're into the dorsal ankle. Dorsal ankle is classically known as the reproductive space, but it is not just reproductive, it's also deep pelvic fascial. So if we think of like a direct reflex for like the psoas muscle, this would be it. All through here. When you see people who have, like especially women who have had hysterectomies that have prolapsed bladder, all through here is super weak. Super weak.
Get out of my head.
Get out. I'm sorry.
Because I was thinking also that and the ligamentous structure around the SI joint as well.
Yeah.
Being in that area.
Okay. So now we're into the cuboid notch, which is the direct reflex for the knee and the leg. So very interesting to see what we'll find here. And that quad is just bracing for dear life. Lord.
Is this all?
It's
I can hear it.
It reminds me very much of that Buddhist parable when Buddha is undergoing all of the starvation and all of the withdrawals, like not to promote Buddhism or anything, but just it's very apt when we talk about muscle tension, and there's a man playing like a guitar type instrument on a boat, and he has this realization: if the string is too tight, you can't play music because the string snaps. But if the string is too loose, you can't play music because it's not tight enough. And so we always want to strike a balance with tension, and his strings are too tight.
Yeah, I'm getting twitches everywhere.
Yeah. And as we start to kind of zone in on the area of kind of deepest dysfunction, the body starts to respond deeper as well.
In almost a kind of a cascading fashion. It's like left side lighting up, back shoulder, left right wrist, upper left cheek.
Right.
Just kind of
Notice how he said wrist as
And
well with
ankle
zone
and
4,
arm.
zone 4, zone 5. Yeah. Okay, so now we move on to the plantar surface of the calcaneus to really clear out zone 5 and the sciatic nerve root. One of the things that, and what he's saying is totally appropriate with the sensations now being all over. When you do reflexology and you ask the body to heal through nerve impulse, at a certain point the body reaches a critical mass where it kind of knows what you're doing and it takes the session into its own hands. It's like, oh, I get it. You're asking me to do stuff. So you can now sit back and I'll take over from here. And that's very much what's happened, is at this point, like you can see his foot is this nice fleshy red color. His temperature has changed. He's feeling massive amounts of waves of sensation. And that's all the body kind of Tetrising itself around. But it's no longer me asking, it's the body doing. And also, if we wanted to, just really quickly, for those of you who can see, he also has a birthmark freckle on his liver reflex, which is another marker for a burnt out liver and deficiency as well. So just when we think about developing a deficient profile, that freckle being an area of burnt out, it's a fire marker where the body has singed the nerves due to overload. Yeah. Okay. So now that we're done with one foot, we finish with the relaxation techniques. And then we do the exact same thing on the other side. The routine does not change from side to side. It's the exact same thing. So you learn one side, you learn both. The only thing that would be different is if we were to find different points on that side, but that's based on your palpation. There are no, in my system, the way that I was taught is very different from how I practice. The way that I was taught was if somebody comes in with diabetes, if somebody comes in with a symptom, there are these buttons that you need to push in order to make them feel better, in order to fix the issue. And that is something that I'm directly opposed against, is the set routine for wellness, because we don't know without palpation what's actually behind that condition. Yeah. If I were to just work with this person as a lower body injury thing, you know, I wouldn't release the toes, I wouldn't release the ball of the foot, I wouldn't even touch there in some cases, which can be terribly inappropriate for a holistic experience. And the body may even resent you for that. So we want to always give a full treatment whenever possible, but then also, you know, keep your mind open. Don't just think of somebody as what they're coming in for. Think of them as a sum that's greater than their moving parts. So now we get to see what's on the left side. And that's always really fun when a client feels more on the side that doesn't have the issue, or feels less. You know, it just depends on where the body chooses to take the session, but there's normally a sharp contrast.
Also, while you're working the left side, you've had a couple of questions from people who came in later into the treatment. If you can just point out sort of the specificity in the neck reflexes, and then also if you can show them the cuboid notch so they know what you're talking about.
Yeah, so we'll get to the cuboid notch towards the end, so
Yeah.
stick around. But the neck reflexes, so again, we talked about this morning, but just for reference, the neck reflexes are divided into the pad of the toe, which represents the head. So that includes sinus, teeth, inner ear, gums, like all of the soft tissues of the face are in that head pad of the toe. But then the neck of the toe is those middle and proximal phalanges of digits 5 through 2, and then the proximal phalanx of the big toe. If you wanted to think of it really simply, where the big toe bends is the separation between the upper half of the head and the lower half of the neck. Pretty easy to remember that. The little toes just have to make it complicated with an extra bone. I don't know why.
same, do you find it harder when people are on like antidepressants or anything like that, for them to like release or anything
No.
like
The body always does what it's supposed to do. Sometimes to a client's detriment at first. I've had many clients come in to see me and they have a good session, a quote-unquote good session, but then the body proceeds to trigger what we would call a healing crisis. When we work with mental emotional issues and trauma, this can be a very sticky and very hypersensitive process. For those of you that watched our video last month that we did during training, we actually had an emotional release on the table, which was a very beautiful experience for us to capture, and was very popular with everybody who had never seen that before, and it was just so perfect. But regardless of what somebody's med profile is or health history is, if the body feels like it needs to take the session into an emotional space, it will take it into an emotional space. You have no choice in the matter.
So does it matter what medications are on it? It does it?
Nope.
Okay.
Nope. And that's like if you come in to see me for a session, you'll notice that my health history form is very plain. I have you put down your contact information. I ask you why you're coming in and any comments that you have, and then I have you sign at the bottom, and that's it. I don't ask for a meds list because that's not my job. Yeah, my job is to get in and tell you what I see. It's to work with what I have in front of me, not to be jaded by what you think is happening, not to be influenced by what the doctors have already said. Yeah, I'm not your doctor, nor do I want to be, you know, but at the same time, if you are coming in for answers, then I need you not to give me your answers before I'm even able to ask a question. Layers within layers. Sorry.
Do you do some notes afterwards?
I do not. However, as good students, you will have to. I've done my share of soap notes, and I find them terribly unhelpful. I document my sessions to HIPAA requirements in terms of the first and last name of the client, their contact information, the date of service, time of service, duration of service. On their health history form, they're more than happy to write their own kind of complaints, but the information that we discuss during a session, I would like to be fresh each time. I would not like to be jaded by what I've noted in the past personally, or what the client has told me in the past. So in terms of like you getting certifications and you doing documentations for that, that is such a valuable process for you to learn. But from a clinical perspective, I like to keep things new. I like to keep things unbiased, and I certainly don't want to be misconstrued as diagnosing, prescribing, and treating. So I keep things outside of writing. I will never write a prescription for my client. I don't want any notes that I take to be misconstrued as a prescription or a diagnosis. So I avoid that, and I say, look, you might want to research this. You might want to do that. And if I forget about it and the client's like, you remember how you told me to do this and it really worked? I'm like, sure, sounds like me, you know, but I would rather have that happen than me say, so how's this issue, you know, and force the remembrance of that condition when they were coming in for something totally different. Back to that kind of concept of identifying with the disease. Yeah. Mm-hmm. So at this point, the endorphins are hitting him pretty hard.
It's like a fireworks show.
Yeah. And when clients, and that's a really important thing to discuss as well. When clients say they see things during a session, sometimes that can be very disconcerting to clients, especially clients who have never had a nervous system oriented form of body work. So when clients see things on the table, what they're actually witnessing is their own nerve impulses. So what's happening is the visual stimuli from the outer world, which is received by the eyes, yeah, is being shut off because the eyes are closed, unless they're one of those freaky clients that keeps their eyes open the whole time. We all know those. But if a client closes their eyes and they still see things like fireworks or they see flashes of certain colors, that's because the optic nerve is relaying electrical impulses that are coming from inside the body. And it's just trying to decode what that looks like.
Can we tell anything with colors? Because I have had a lot of people say they're seeing, feeling colors.
Right. Yeah. And that's very synesthesia. Like, that's very much we're lighting up multiple sections of the brain at once as the body's trying to, like, undergo its healing process and mentally defrag. I don't interpret those colors. I find that it's a very gray area because the body is very subjective. What yellow means to you may not be what yellow means to me. You know, and likewise, we could use traditional chakra system. We could use, you know, so many other color orientations that give us an explanation. I find that it muddies the process.
Speaking on it being different for everybody, for me personally, whether it be in like different forms of therapy or meditation, the color purple has always kind of followed me ever since I started my meditation process, which is what I'm getting a lot now, just like a lot of weighty, cloudy purple. So different for everybody.
Yeah. But for a client who has never had that experience, again, they might think they're going a little crazy. So it's important for you to understand how to talk them off that ledge from a logical, physiological standpoint. Instead of them just being like, so this person did this thing and I don't know what they did, but I kind of saw colors and I think I might be losing my mind. You know? So we're doing the exact same process, moving through the toes to the dorsal aspect to the horizontal zone 2 chest reflexes. Now we're moving into the digestive space. When a client comes in, I don't give them the play-by-play. So a client will come in, and especially if they've seen reflexology or heard about it or have had other reflexology experiences, it's tempting for them to say, I want you to tell me everything. Tell me everything you find. I would much rather somebody enjoy than feel the need or obligation to work during the work. Yeah? If somebody is absolutely adamant that they want the play-by-play, I'll give them the play-by-play. But it's more therapeutic for them as the client and you as the practitioner to wait until the end, until you're able to gather all the information and tell them like a summary of what you found. Okay, so we have a nice little kidney reflex that we're just gonna chill on.
Oh, hi from Canada, hi from Dublin.
Hi Canada, hi Dublin. Can't wait to see you, Dublin. Going over to Ireland for the first time this year.
So exciting.
Yeah.
I was gonna say we just put the registration site up for Enniskillen.
Yeah.
So footwhisperer.com/Enniskillen to register for that one, and we'll have some more up soon.
Do you have the dates? Well, I guess you have the dates.
Yeah, so we're doing the Ireland conference, the Reflexology conference in Ireland, the third weekend. The second weekend, the weekend before, I'll be doing Enniskillen, which is up in Belfast. And then after the weekend after the conference, I'll be doing Dublin. And then I'll be flying over to the UK to do a second round of the tour there.
Oh, and hello from Perth.
Oh, hey, Perth. I'm coming for you, Perth.
Right.
Of what month would that be?
That would be, so
September.
Ireland is September.
Yeah.
I'm going to Perth, Australia in June.
Yeah. So Perth Fremantle is June 1st and 2nd, and Enniskillen is September 14th, 15th.
This September? No.
This September.
Yeah, this September. Okay. So we've got another nice little point right at that intersection of the diaphragm and the upper digestive reflexes. This is a reflex point that I often associate with an acid reflux type tendency. But again, when we think of the body as an earthy constitution but displaying weakness, when people have like hiatal hernias, it could be due to the fascial integrity being compromised, not necessarily because of acid reflux, but literally a hiccup could trigger that breach of the organ into the lung space. You know, so just something to think about from that standpoint. But also like general stuff like stress and breathing and all that jazz. I've had some yogis that have a very pronounced and dehydrated diaphragm guideline, and I asked them about their pranayama practice, and they're like, "It's so funny that you mentioned that because I've been hitting the pranayama very hard." I'm like, "Yeah, and you're freaking out your diaphragm, you know." So everything in moderation, you know.
Oh, it's one of our friends from Brighton.
Oh, Brighton. Loved Brighton. Brighton is like the Tampa of the UK.
It is.
Because it's right by the ocean. It's kind of half New York, half Tampa. So pretty.
You're gonna run you all over the place in Ireland this time, like you did last time, or?
No, I'm just doing the 3.
So you
Just
get to actually see it.
yeah, it'll be nice. Chase. If you wanted to think of our approach to reflexology, the grids, the map, yeah, each reflexology section, it's like we're clearing the vertical zones. We're pushing the energy through those channels. We're opening up the nerves in those specific sections. However you really want to say it is fine with me. I really don't care, whatever kind of cosmology you want to use to describe the process. But it's very much like a street system. It's like a grid system. So we're saying, in this horizontal zone, we're doing these 5 vertical passes 3 times each in order to clear, to palpate, to open that whole reflex. If you just think of it that way, it's a lot easier to understand. We're almost done. You're doing great. Just keep it up. You'll get a gold star. You won't get a gold star, but you will get cake.
Same as last year?
Same as
Feel
last
good,
year.
so good enough.
There you go. Feel good. Yes. The cake is from Wright's Deli in Tampa. It's a 3-layered chocolate alpine cake. Oh yes. Those of you who have decided to give up sugar, I feel so bad for you.
It's always been talking about for 2 months is the cake.
It is such good cake though. And I don't do cake like that.
I remember last year.
Yeah, I
'cause we
don't do
confiscated
sweets.
the
Yeah,
rest.
me neither.
Messes with my stomach,
Yeah,
so,
I can't. But it's special
So
occasion.
we're all gonna deal with cake issues
Yeah.
tomorrow. It'll be good.
Karen McAvoy asked about contraindications for performing reflexology, especially because your consultation form is simple.
Great. So if a client asks, what do you want to know? I always say, do you have any injuries to the feet? Yeah? Any issues or injuries with the feet that would cause pain or hurt during the session? Like, that's my first priority. Is it going to hurt? Yeah? I had a client come in yesterday, and she said, yeah, well, I broke my foot a couple months ago. I'm like, oh, and you decided that it would be a good time to get it worked on? Okay. But it had perfectly healed. There was no pain, there was no inflammation, and so it would raise a red flag from that standpoint. But I get clients as well who know me, who have experienced the work, and they'll call the day before the appointment or sometimes the day of the appointment, and they'll say, Sam, I just wanted to run this by you. I just stubbed my toe. I have this big blister, or this, I hurt myself in some way, shape, or form. And I'll talk to them about, whether or not it's appropriate for them to get work done. But remember that with our School of Reflexology, we're not just teaching you how to do feet. Yeah? We're doing hands, face, and ears as well. So if somebody's extremity is compromised, or especially because we're by MacDill Air Force Base, yeah, if an extremity is not present, yeah, we can always jump somewhere else. But if somebody's in the middle of a severe allergy attack, it might not be the best time to get into the sinuses. You know, it might be appropriate to go to the opposite end of the spectrum and to pull that energy down. Yeah.
Get it moving.
Yeah, exactly. You know, but there is a value. A client comes in with like carpal tunnel or arthritis in the hands. Touch that space. Yeah, even if it's just for a little bit. Even if you just start with a couple of the relaxation techniques and some of the finger work that we're going to learn tomorrow, you know, make it a point to just make contact with the area that hurts. The client asks, you know, why would you do feet instead of hands, instead of face, instead of ears? And I always say, if it feels good, yeah, or if it's needed. Somebody comes in with a foot issue and you tell them you're going to work the hands, they kind of look at you funny. Yeah. But if you work within the client's expectations and then pair that with your own knowledge, it becomes easier to determine what's contraindicated. But my baseline is if it's broken, if it's oozing, bleeding, or hurt, you know, we obviously don't want to touch it.
St. Patty's, I was doing triage.
Yeah.
With some, I mean, because we had, my husband's one of the singers, and it's like, we had 6 gigs in minimal days, and his voice had really went out.
Yeah.
And I'm like, I'm not getting to those feet, they're grungy. I mean,
Yeah.
we've been running, we did 400 miles in that weekend, and his voice, I heard, it went, and literally, and I'm going, I'm a believer, I drank the same Kool-Aid, but it was like, I'm going, I gotta just get to your hands.
Yeah.
And we worked the throat, and he actually was able to get through the resin. He's like, I can't believe this, because he has allergies really bad, and it's, you know, it's been all about the sinus the last,
Yeah.
I mean, and feet, I just worked on the feet for the sinus, and it's just, whoosh,
Exactly.
it's been really
Pulling it down.
Do you ever ask if any woman is pregnant or anything?
That is a great question, and we addressed that very heavily during our reproductive system weekend. If a woman is pregnant, I don't care. The reason for that is because there's nothing that we would do as reflexologists to injure the pregnancy. I have ladies come to me cloaked in the dead of night, saying, I am 2 weeks past my due date, and they write on their health history form, get this baby out of me. And that's I can show you the forms. It's hilarious. That's what they write. Underlined exclamation point. And so I've tried. And if the baby's not ready, the baby's not ready. And so with pregnancy, there is no contraindication. Yeah. Unless you are a body worker who is intent on causing any level of harm to stimulate that process. That's where I would draw the line. Because if the body feels you are a threat, yeah, if it cannot lock you out and you do damage, then it could overstimulate, you know. But we're not using tools. We're not aggressively bombarding the space. And I've never had somebody go into labor on my table. And that's part of reflexology's effect as a balancing modality, not a let me inflict healing on you modality.
For Amy, who's asking, yes, you can take our classes. You can take live classes here, or you can take the online, the Foot Reading Online Certification course. Just go to footwhisperer.com. There's a whole list of pages there to help you find what you need. And then there was also a question about, what method of reflexology do you do?
This is trademark pending palpatory reflexology. That's what I've decided to call it. But I've been practicing for 8 years now. 8 years. And I'm just coming up with the idea that our style of reflexology is about feeling first and applying pressure second. And so we are working with what the body is giving us, and we are allowing the body to guide the work instead of us doing a systematic approach. But this is a technique that I created based on me being trained one way and clients saying, please don't do that, and adapting accordingly. So for those of you that were watching as I was talking, there was a lot of hip stuff on this side, a lot around that lateral ankle. So he spent some.
that ankle that just like immediately like a hot zone.
Yeah.
Like hot flush coming over my face, and just really intense awesomeness.
Yeah. Go ahead. You had something? No? A thought?
No.
Are you sure?
Yeah.
Carolyn Grasser said, I call it Sam's way.
Oh, Sam's way. Carolyn, I love you so much. Thank you. Yeah, so now we're in the dorsal aspect of the pelvic, so all in that deep kind of fascial connective space in the pelvic. And there's just a lot here. So we're feeling around, seeing what the body wants us to do. Holding a point, waiting for a response. If the body draws you in deeper, it wants you to engage that space a little bit more. If the body presses you out and it defends against you, you know that you're in the wrong place. If nothing happens, move on. But the body is very vocal if we just learn to listen. Have to press there's some deep squishy, that's the technical term, in here. So we're pressing some of that out, and as I'm doing that, I'm physically getting hot. Very interesting, the sympathetic response that you take on when your clients undergo their own healing process. Your body tells you what's happening in their body. Very interesting. But yeah, it's like right around that artery entrance. So you can feel the pulse, but it's just so stagnant in through there. Okay. We'll get out of that. We'll stop screwing with it. Okay, so this is cuboid notch. Okay, so cuboid notch, we have the proximal head of the fifth metatarsal. Then the cuboid notch, despite its name, is shaped like a triangle. And it has three different sides. So we have the proximal head, which is the start. Then we go up to the divot, and then we go down to the back, and then we go across the bottom, and that's the cuboid notch. The ascending portion represents the quad muscle. The descending portion represents the hamstring. Sorry, we triggered that little nerve twitch. And then the bottom part of the triangle represents the calves. And so as we trace throughout this triangle with that proximal head of the fifth metatarsal representing the knee itself. And he has all of this hamstring stuff happening. So we need to ask the body for forgiveness because I kind of ran over that a little bit too fast. So we're going to hold the hamstrings. We're going to allow, also very interesting, I'm finding hamstring stuff on this side, but there was quad stuff on the other side. So perfect counterbalance.
Yeah.
What would you recommend to massage therapists looking to incorporate reflexology when, say, using reflexology to assess for, say, the first 30, 45 minutes and then going into hands-on for other massage modalities?
100%. You could speed up this routine to just get through the reflexes to feel, and then do spot treatments for the last bit.
That's almost exactly what I do now.
Yeah. And it's so accurate, and it makes the work so much easier, and it relaxes them. It puts them in a state of receptivity. Yeah. So you relax them, you get them really, really kind of zoned out. And then once you know where the issue is, where the true issue is, not where they think the issue is, but where the true issue is, you can go straight to that area based on the body's guidance instead of wasting your time groping around in the dark throughout all the muscle tissue. Only to realize after you work the glutes that was the tightest part, so I should probably go back there, but they're already flipped up right now, so what do I do? We've all been there.
The other thing about him is the idea that it's the quad on one side and the hamstring on the other, and the fact that his original damage was a cruciate tear.
Right.
So that front to back tensile strength.
Right.
Really interesting.
Scott is our structural expert. He's teaching a fascial stretch class.
Myofascial release, anatomical testing, and tabletop stretching.
When is that? Next month?
Yeah, that's next month. The 13th and 14th, I think, is what it is.
Yeah.
Also, I'm putting out a dermatomes online class, and so it's just all The intro class is already up on my Teachable.
Oh, it is?
Yeah. It's on Facebook. You can find it.
Okay.
I'll send it to you.
They have other teachers
But I've got a free intro hour out just explaining what dermatomes are, but I'm rolling it out in 4 segments over the next month and a half.
Because I have nothing else to do.
You know you're a massage therapist when you have like some sort of YouTube or audio recording of like very intense medical knowledge in the background at all times. Like I'm making dinner and I'm cleaning up after dinner and I'm listening to energetic tissue states according to medical astrology. Like that's been my week this week as I do research for the book. So it's just like it never ceases the knowledge. Okay.
You know you're a reflexologist when your husband knows what Sam sounds like before you even meet
Right.
Sam. I couldn't believe, yeah, because when you finally met him, it'd been a year, and he's like, haven't we met? And I'm like, well.
Close your eyes, Jean.
Yeah.
Close your eyes and listen to my voice.
Let's listen to Sam over dinner, okay? Great.
Yeah, that's funny. Yeah, so the routine that I'm going to teach you is solid. Like you could just do the routine. So the advanced point work and stuff is something that you need a feel for, because the first couple times you do the routine, you're so focused on getting it right. Yeah, which I encourage you to memorize it. But I'm giving you a little bit of deviation here. So after I'm done, there we go. After I'm done with the routine, I'm actually coming back to that hip because it's messy, it's nasty, it's not fun. So it needs a little bit of extra attention. And we're just going to go back through those reflexes. Right now we're at, if we wanted to think of the ankle itself, the ankle bone, as the hip.
I can actually feel my sacrum kind of lighting up right now.
Yeah. Cool. So the hip joint is that lateral malleolus. Yeah. But then all of this tissue on the lateral side of the calcaneus represents the glutes. The posterior surface represents glute max. The inferior surface represents glute minimus. The anterior surface is glute minimus, or medius minimus. As it goes naturally, it goes from back to front. Yeah, it goes from back to front. So as we look at where somebody is having pain specifically, or where the tension is, we can say, hey, you should stretch this part of the glutes.
Rosie, I don't want to self-publicize on here, but I'll send you a message when we go on break.
Is that Rosita? Is that?
Little Rosie Sunshine?
Oh, Little Rosie. Fun. Okay. So, yeah, and that's about as clear as it's going to get, really. That's pretty much about it. So we'll finish with the relaxation techniques. I've already got my dry towel, so if somebody could just pass me 2 hot towels, that would be flawless. Steamed up and ready to go. I can't grab them at the moment, dear. My hands are otherwise occupied.
It's ready for you.
Thank you.
And who's done that a million times? Me? They never know they're asleep.
They never know.
Right.
Just
In a sterile environment.
It's like, yeah.
sterile environment.
Set off.
I swept that.
It's good.
Sure, Dana. I will also message you.
Question?
No, I'm just moving positions.
No thoughts?
I'm just taking it all in.
It's a lot of information for an hour treatment.
Yeah, and part of the beauty of you guys dropping into a class like this is that you get exposed with everything really, really fast, which is both a blessing and a curse. You know, you get to see what's possible, you know, but at the same time, you know, you'll know exactly like, oh yeah, that makes sense. Oh yeah, I'm interested in that. Or what? What did you just say?
Oh, Sam, do you use some kind of like lotion or something? Or something
Yeah.
easier?
So I use a shea butter, which is the
Okay.
yellow stuff in my arm.
Mm-hmm.
I'm in the process of making my own balm, but I haven't got the ratios right yet. But I normally use a butter or a wax or a cream, like a thicker cream. I tend to avoid oil at all costs because it's sloppy. And it gets, especially when you're like in the toes and you're trying to get into those specific points, the oil makes it too slippery. but the thicker creams will dissolve into the tissues better and will respond to body temperature. Ooh, that one was a little spicier than the other one. But yeah, so that's what I use for my sessions.
So you want something like where you can get good grip on
Yeah.
it? Okay.
Yeah. But then the reason why I like the shea butter is because you'll see that it's yellow because it's unpurified. It's not bleached. Yeah. It's boiled down into the nut butter, but it still has all of its minerals.
Okay.
Yeah. Which is what I like for the skin, especially when somebody comes in and the skin is very dry, it's very dehydrated, it's very cracked. The butters can get in there and really nourish, as opposed to a cream which has been like processed with all these preservatives and stuff. Only ingredient in this is shea butter. You know, and I buy it in big yellow blocks.
When you have one of his feet uncovered, somebody just wants if you could kind of point out the area you would work in terms of SI stuff, or just, you know, if you can.
So when we look at the body from a reflexology perspective, it can also be very important for us to recognize that the spine is the medial arch. So the head, which we've already talked about a couple times, is at the big toe. But then when we look at the different sections of the spine, each part of the spine is following the skeletal structure of the foot, which goes a little something like this. Cervical spine. So the proximal phalanx to the metatarsal phalangeal joint. Then the head of the distal metatarsal head of the first metatarsal to the proximal head is thoracic. So cervical, thoracic, and then lumbar would be the tarsals. And then SI would be the medial surface of the calcaneus. So that's sacral coccyx. Yeah. So it's top to bottom, just like it is. So cervical, thoracic, lumbar, coccyx. Super easy. It's about seeing the foot as the body, not about memorizing reflexes, but seeing the entire system through the part. Let's see. Pulse has gotten slightly stronger, albeit not terribly stronger, which again speaks towards the deeper deficiencies. One of the things when a client comes in and you see patterns of deficiency, you can't feed them. You can't give them what they need through such a manual method. Like you can't nourish depletion on the table, which is hard for a lot of people to kind of come to grips with. But that's the case here. Like we would see more drastic change if he had the resources that he needed and we were just moving stuff around. Like really interesting to see case studies like Sally publishes with the fluid moving in lymphatic cases and lymphedema cases when there's an excess and we can get the body to release. Yeah. But if they're already scraping the bottom of the barrel and there's nothing left, yeah, we can't give that to them through a session. We can clean out the barrel, but it's still empty. So that's kind of where we're at. Cool. Okay. All done.
Sweet.
Any other final thoughts or questions before you bring yourself back, my good sir?
Probably my first official like nervous system therapeutic treatment, and that was really intense and awesome. And I can't wait to apply it to my own practice.
Cool.
And get back to my other friends and say, people are like, well, what do you actually think about like reflexology and foot mapping? You think it's like, you know, like something to it? And I was like, I mean, I definitely know nerves end up there, but I'll tell you more when I get back.
Yeah.
And so now I definitely have more to tell them.
Yeah.
And can't wait to get all my, not necessarily I won't call them skeptics, but not yet confirmed believers
Yep.
of understanding the system.
And that's another really important thing to kind of talk about is reflexology is not a modality that relies on belief. Yeah. We're not. This is both an art and a science. So it's an art because we're feeling, we're changing, we're adapting the session to the person that's on the table. We're working with what we find, not necessarily a set, routine. Although we're using a routine to feel for how we can customize. Yeah. But when a client comes in, there's a science to it. Yeah. When something happens in this place, it means this. Yeah. When there's tension in this space, there's nothing else it could mean other than sacral. There's nothing else it could mean other than stomach. Yeah. That's the science of the mapping. And so it's not necessarily, it's a modality that's full of skeptics, because if you Google reflexology right now, Quackwatch comes up, Wikipedia comes up and says that it's a non-scientific approach. It's a non-scientifically verified modality, which they need to update because of people like Barbara Scott, because of people like Sally Kay, who are publishing the studies saying that reflexology does help with fertility. Reflexology does help with lymphedema. Here are the pictures. Here are the studies over time that show this. We haven't been able to prove the connection with digestion, but his stomach sure gurgled. Yeah, so the client knows.
Before the power of suggestion could be blamed for it.
Exactly. So there is an element of like, ooh, this works, but it doesn't necessarily need to be, this works, trust me. It's more of like, if it works, great. If it doesn't, try something else. Yeah? Go get acupuncture. Go try yoga. I'm not offended if this isn't your modality. But that doesn't mean it didn't work. Yeah? Cool. Awesome.
All right.